Well, today, we're exploring a complex condition, systemic sclerosis, associated pulmonary hypertension, often abbreviated as SSPH. This is a serious complication that can arise in individuals with systemic sclerosis, also known as scleroderma, significantly impacting lung function and overall health. Join us as we delve into the causes, effects, diagnosis, and management of this challenging disease. Let's begin by understanding the causes. SSPH develops as a consequence of the underlying systemic sclerosis. Scleroderma is an autoimmune disease characterized by the overproduction of collagen, leading to thickening and scarring of the skin and internal organs. This process can affect the blood vessels in the lungs, specifically the small pulmonary arteries, contributing to the development of pulmonary hypertension. Now, let's examine the pathophysiology. In SSPH, the small pulmonary arteries undergo significant changes. These changes include thickening of the vessel walls, narrowing of the vessel lumen, and the formation of scar tissue. This restricts blood flow through the lungs, increasing the pressure within the pulmonary arteries. This elevated pressure, known as pulmonary hypertension, forces the right side of the heart to work harder to pump blood through the lungs. Over time, this can lead to right heart failure. Understanding the epidemiology of SSPH is crucial. Pulmonary hypertension is a relatively common complication of systemic sclerosis, affecting an estimated 10 to 15% of individuals with the condition. It is important to note that SSPH can occur at any stage of scleroderma and significantly impacts patient survival. Early detection and intervention are essential to improve outcomes. What are the signs and symptoms to watch out for? The symptoms of SSPH can often be subtle and may overlap with other complications of systemic sclerosis. Common symptoms include shortness of breath, particularly with exertion, fatigue, chest pain, lightheadedness, and swelling in the ankles or legs. In some cases, patients may also experience Raynaud's phenomenon, characterized by color changes in the fingers and toes in response to cold or stress. It's important to note that symptoms may initially be mild and gradually worsen over time. How is SSPH diagnosed? The diagnostic process typically involves a combination of tests. A physical examination and review of the patient's medical history are initial steps. Non-invasive tests such as an echocardiogram, which uses sound waves to create an image of the heart, are often performed to assess the pulmonary artery pressure. Pulmonary function tests help evaluate lung capacity and airflow. A right heart catheterization is the gold standard for confirming the diagnosis and assessing the severity of pulmonary hypertension. This procedure involves inserting a catheter into a vein and guiding it to the right side of the heart and pulmonary artery to directly measure pressures. While there aren't distinct types of SSPH beyond its association with systemic sclerosis, the severity can vary. Pulmonary hypertension is often classified based on the degree of elevation in pulmonary artery pressure and the impact on the patient's functional capacity, ranging from mild to severe. Let's discuss treatment and management. Unfortunately, there is no cure for SSPH. Treatment focuses on managing the symptoms, slowing the progression of the disease, and improving the patient's quality of life. This may involve medications specifically designed to lower pulmonary artery pressure, such as endothelin receptor antagonists, phosphodiesterase 5 inhibitors, and prostacyclin analogs. Supportive therapies such as oxygen therapy, diuretics to reduce fluid buildup, and anticoagulants to prevent blood clots may also be prescribed. In some cases, lung transplantation may be considered as a last resort. Currently, there are no definitive ways to prevent SSPH in individuals with systemic sclerosis. However, early diagnosis and aggressive management of the underlying scleroderma can help minimize the risk of developing pulmonary hypertension. Regular monitoring of lung function and pulmonary artery pressure is crucial for early detection and intervention. Finally, let's consider the prognosis and recent advances. The prognosis for SSPH can vary significantly depending on the severity of the disease and the individual's response to treatment. Early diagnosis and prompt treatment can improve outcomes. Research is ongoing to develop new and more effective therapies for SSPH. Recent advances include the development of new medications targeting different pathways involved in the pathogenesis of the disease. Clinical trials are exploring the potential of stem cell therapy and other novel approaches to regenerate damaged lung tissue and improve pulmonary vascular function. These advances offer hope for improved outcomes and a better quality of life for individuals living with SSPH. Remember to consult with your healthcare provider for the most current information and treatment options specific to your individual needs.